this segment, we're going to be talking about intradiscal PRP treatment of lower back pain, which has become one of our favorite forms of treatment that we can provide to patients that have ongoing lower back pain. Low back pain is the most common cause of disability in patients aged 45 to 65 in the United States. And in fact, according to the CDC, accounts for 70 million people having disabilities secondary to ongoing lower back pain, which may result in episodes of absence from work due to ongoing back pain and sometimes permanent disability because the pain is so significant that it does not allow the individual to return to any type of work. So it is a very important disability or injury that treatment is necessary. Of course, an individual with lower back pain initially should start treatment on what we call a conservative basis. Usually this includes activity modification. That's self-explanatory. Just avoid heavy lifting, bending, stooping, and other activities. If this is a work-related injury, when we evaluate you, we'll likely give you work restrictions, which you need to follow at work. Then usually therapy is initiated either in the form of physical therapy or chiropractic therapy. Both can be very effective in helping manage your lower back pain. Usually we prescribe an anti-inflammatory medication. These are best only on a short-term basis because of long-term side effects. We also like to recommend acetaminophen because it has lower gastric issues and can also help reduce pain. We obviously try to avoid opioids or narcotic medication because this is a long-term treatment, and if you use opioids, you'll become addicted. And that becomes then a secondary problem for you. Having exhausted these treatments, then we usually proceed with obtaining X-rays and MRIs, which will identify which discs or parts may be injured. Now, back pain can be secondary to many factors. It could be a fracture, which would be treated differently. You could have what's called radiculopathy, and that means that you may have what's called a pinched nerve. A disc may be pressing on a nerve, and in this case, you're going to have severe pain down your leg, numbness or weakness. That treatment is different, and this disc PRP injection is not used for that problem. Older individuals may sometimes develop what's called neurogenic claudication or spinal stenosis, where they have ongoing lower back pain, numbness and weakness in the legs with walking and standing, and then the MRI will show compression of the nerves, and again, that's treated differently. So we're talking about somebody with what's referred to as discogenic back pain. And discogenic back pain is easily diagnosed. Usually the pain is worse with flexion. So you bend forward to bend something or lift it, your back pain increases. Usually individuals with discogenic back pain also have trouble with prolonged sitting. So that's a way to also diagnose it. And of course, once you've exhausted physical therapy, chiropractic, and MRI will identify which discs may be problematic. And these are discs that may well be suited to treatment further. It's estimated that about 40% of lower back pain is due to discogenic pain. So again, there are other causes, fracture, soft tissue problems, or muscle strain that's easily treated with physical therapy or chiropractic, and even massage therapy. Radicular pain, we've talked about that's different. Also, sacroiliac joint pain may be a consideration. Pain may be emanating from sacroiliac joint, and people estimate 20 to 40% of lower back pain may be due to inflammation or pain from your sacroiliac joint. So if the pain is from sacroiliac joint, you're not a good candidate for intradiscal PRP injection. So intradiscal PRP has been around a long time, first described back in 2011. We've offered it in our clinic for at least 7 or 8 years, and we've now treated hundreds of patients with very good results. But it doesn't work in everybody. There are people that have the injection and it does not result in any improvement. So you have to be aware that there is a failure rate. Why is PRP effective? Well, PRP again is obtained, stands for platelet-rich plasma, and we obtain that from your own blood. So it's a very natural form of treatment. We're using your own blood. We then centrifuge your blood and concentrate the platelets. The platelets then are what promotes the healing. You have high levels of platelets in your body, and these are concentrated and then injected in the site of injury. We've already talked about PRP being used effectively in problems such as shoulder tendonitis, elbow tendonitis. These are where it's been noted to be highly effective. In some areas, it doesn't seem to work as well, such as Achilles tendinopathy. It does not seem to be as effective based on many studies. But disc PRP injection has been shown to be effective, and this is injecting the disc directly with PRP. PRP contains many growth factors which are released. These have fancy names such as platelet-derived growth factor, insulin-like growth factor, transforming factor, vasoendothelial growth factors. These growth factors promote healing. They have been shown in animal studies to actually increase proteoglycan and type 2 collagen. These are the important building blocks of your disc. So an intervertebral disc, as I show here, is the cushion between your vertebrae. It allows for mobility of your spine and cushions the blows. When you bend, sit, you can see the disc bulges a little bit and cushions your back. And then when it's worn out, injured, or degenerated, it doesn't work. So the disc contains collagen and proteoglycan, and this is the substances that give the disc flexibility and that cushioning effect. We know that injection of PRP then promotes production of proteoglycans and improvement in collagen synthesis. In animal studies, there's actually been shown effective reformation or restructuring of the injured disc and actually improved height of the disc. Now, it's difficult to reproduce this in human individuals based on the fact that ability to investigate or these are more difficult in humans. We certainly cannot injure a disc voluntarily and then study it. But we know that there are many patient studies that show it can be effective. In addition to growth factors, the PRP contains fibrin, and fibrin can heal annular fissures. So what are annular fissures? They're basically tears in the disc, and we found that these annular fissures can be a high source of pain. Annular fissures can occur spontaneously or due to an injury, either a work injury, car accident, sports injury, such as basketball, where you jump up and suddenly twist your back and tear the annulus or the lining. And we found out that by sealing this, the pain reduces. Dr. Kevin Pauza promoted a product called Discseel, where they inject fibrin and have noted significant improvement. But PRP injections also contain fibrin and can help seal the disc and seal those tears. In addition, we know that PRP has anti-inflammatory effects, so reduces inflammation, and has an antibiotic effect. That's very important because one of the risks with doing a disc injection is infection, and because the PRP actually contains some antibiotic properties, it helps reduce it. But we also administer antibiotics to help reduce the risk of infection. So if you're in a clinic and we're doing a PRP injection, we will usually initially give you intravenous antibiotic before the procedure, so that antibiotic is circulating in the system. And also additionally, when we draw your blood will contain some antibiotics, which helps reduce potential risk of infection, which is a possible complication with this procedure. Otherwise, risks of this procedure are very limited. All the reported studies show it's quite safe to do this procedure. We also know that injured discs have high levels of what we call inflammatory cytokines, interleukin, tumor necrosis factor alpha. These actually cause inflammation in the disc. And it's very important that people have done studies, and painful discs that undergo surgery, have a higher level of these chemicals than normal discs. So we've always asked the question, why is some person with a bulging disc that may be small have a lot of pain, and yet somebody with a larger disc doesn't have pain. The clue is that disc herniation causes pain, but the size of the disc, it may not be important because it's also a chemical reaction. So you have annular tears, little tears in the ligament outer lining, and then these chemicals from the disc, inner portion of the disc, can leak out and cause an inflammatory response, which can cause back and leg pain. And that's why injections such as epidural injections, which contain steroids, which reduce inflammation, can be effective. The PRP contains an anti-inflammatory effect and can reduce inflammation from these inflammatory cytokines, and that's why it can be highly effective in treating your back pain. One of the hallmark articles in doing the PRP injections and promoting that is highly effective was by Dr. Gregory Lutz in the Journal of Physical Medicine and Rehab, published in 2016. The study is called Lumbar Intradiscal PRP Injection, a prospective double randomized blind study. And he looked at 58 patients and randomized them to ones receiving PRP and other ones not receiving it. Of importance is he outlined factors which we found important in screening individuals. So he stated in his article that pain should have existed for 6 months. So again, initially, if you have back pain, the treatment is conservative physical therapy, chiropractic, exercise, and not jumping into a PRP injection. The disc height must be at least 50% of normal. So you don't want to do this in a collapsed disc because likely it's not going to work. And he chose disc protrusions which are less than 5 millimeters. So usually when you do an MRI, the radiologist will measure the size of the disc. So it's a large 8 to 9, 10 millimeter disc. It may not be as effective as a disc that's moderate, about 5 millimeters. Now in his study, he did what's called discography, which you inject the disc with contrast and check to see if there are actually those annular tears or fibers, and also if the pain is produced. When we started doing this procedure in our clinic, we were doing discographies, but we stopped doing it for several reasons. One is when you do a discography, it's a painful procedure, and we're trying to achieve pain relief, so we didn't want our patients to experience more pain. The other is that you're injecting additional chemicals into the disc, which may affect platelet function. And our third concern was that the disc can only hold so much fluid, and so if you're already putting contrast, you're limiting the amount of PRP that you can inject. So we no longer do discography. We're not doing scientific studies like Dr. Lutz did. We're just trying to treat our patients to get them better. So we do not ordinarily inject contrast or do a discography procedure, which reduces procedure time and also less pain. Usually, in his study, 1 to 2 cc's of PRP is injected. We typically will try to do 2 to 2.5 cc because we're able to do a larger amount of PRP, and this may make it more effective. In fact, there's a study showing that a higher concentration of PRP is more effective. This was published in the International Orthopedic Journal in June of 2022, indicating that higher concentrations of PRP may be more effective. And in fact, there are articles that show that PRP may not be as effective. This was published by Dr. Shefts and colleagues in March of 2022 in Interventional Pain Management. They did a study where they injected individuals with 1 cc of saline, or basically salt water, and the other individuals in the study received PRP. But they only gave 1 cc, and their conclusion was that PRP was not effective. So we don't have uniform studies showing that it's effective in everybody, and that's why we inform patients it may not work. But the criticism would be that maybe 1 cc is not an adequate amount, and a larger amount may have resulted in greater improvement. We also know that there are multiple studies that actually show it's highly effective. I point to an article by Bradley Weiner and colleagues published in June of 2020, and their question was, is intradiscal injection of PRP for lumbar disc degeneration effective. They used 90 patients and found uniformly that it was highly effective and there's a low risk of complications. Another study by Min Cheng and colleagues, February of 2021 in Journal of Pain Research, the article is titled Effective Intradiscal PRP Injection for Management of Discogenic Low Back Pain and Meta-Analysis. And they studied randomized trials as well as prospective trials, and they noted significant improvement in pain and function with intradiscal PRP injection. Importantly, they noticed that improvement wasn't noted at 1 month, but at 2 to 6 months. So in fact, we always tell our patients, initially your pain will increase, in fact, for a week or two, and then don't expect a lot of improvement for 6 weeks, although we've seen individuals that report improvement early on. But then the improvement, as in Dr. Lutz's study, can be seen for a year or longer. So therefore, there are the ones I've quoted, but many articles indicating that it's been effective in patients. So this is certainly a form of treatment that we're very enthusiastic about. We've now performed the procedure for years with multitude of patients that are very happy with the results, and you may be a candidate for this form of treatment if other forms of treatment have not been effective.